In my OPD, I get to see a lot of patients who want to conceive but they are not able to conceive because of one or the other reason. First of all, when the patient comes to us, we just want to know for how many years she has been married. So if the patient comes saying that I have been married for 6 or 8 months and I am not getting pregnant and she is less than 35 years, we usually don't do any investigations on such a patient. Infertility or subfertility is said when the couple is not able to conceive even after 1 year of regular unprotected intercourse. So once a patient comes to us, she says that she has been married for more than 1 year, we can start with the investigations. Now, how do we proceed with the patient who wants to conceive? Most of the patients, first of all, doesn't know what is their fertility period. That needs to be explained to the couple together. Apart from that, how do we proceed? First of all, we usually go for the husband's semen analysis. This is the first investigation we always get done. Secondly, we then start evaluating the female. That is, we proceed in 4 steps. First of all, we look for the hormonal balance, whether it is right, means the brain signals, that is the signals coming from the brain to the reproductive tract of the women are right or not. Then we evaluate the ovaries, then the tubes of the fallopian tubes of the female, and then the uterus. First of all, we go for the hormonal evaluation, that is the normal the hormones, that is the FSH, LH, the thyroid profile, the prolactin, the estradiol levels, all these needs to be checked. Secondly, as I told you, then we go for the evaluation of the ovaries. Means we want to know how many eggs and what is the quality of the eggs present in the ovary. Then that would mean we go for some blood tests and a routine baseline ultrasound to look for the follicles in the ovaries. Tubes need to be checked for sure because it is the tubes which are responsible for carrying the egg and the sperm. The egg and the sperm actually meet in the tube, and then this fertilized egg or the ovum actually travels through the tube into the uterus where the baby starts growing. So tubes are very important to be assessed. Tubes are assessed by doing a hysterosalpingography. It's just a simple procedure in which we inject the dye into the uterus and look for the patency of the tubes. Or the other thing is that we go in for a diagnostic laparoscopy with chromoperturbation. This is done under anesthesia, in which we again inject the dye and look whether the dye is coming out of from both the tubes or not. If the dye is coming, means the tubes are patent, and the tubes are usually healthy if they are patent. Then we evaluate the uterus. Uterus is to be evaluated for its inner lining, which is called the endometrium, which should grow in accordance with the hormones in the body. Apart from that, we look for any cyst or any fibroid in the uterus. If it is healthy, then the lady usually does not have any problem in conceiving. So it's a basic science. We evaluate the husband as well as the wife, but as I told you, it is to be done only once they have not been able to conceive after 1 year of unprotected intercourse.